All right, let's jump right in. We're going to talk about something that's, super important, but we just don't hear about it enough. And it's this idea that after you hit 70, some of those medical tests, the very ones that are supposed to keep you safe, might actually be doing the opposite. They might be putting your health and maybe even your independence on the line.
So, seriously, before you go and book that next routine checkup, just hang on a second. I really want you to listen to this, because what we're about to get into could totally change how you think about your health from here on out. And look, this isn't about ditching your doctor. Not at all. It's about learning how to make smarter, wiser choices for yourself.
Okay, so you see this number up here? 35%? It looks simple, but behind it is something pretty shocking. Major studies have actually found that for older adults, some of these routine screenings can jack up the risk of serious complications by a staggering 35%. And we're talking about things like nasty falls, infections, or even a decline in your memory compared to people who didn't get tested at all. That's a huge deal.
And this whole chain reaction, well, it has a name, the Medical Cascade. It's kind of like a domino effect. It all starts with one test, maybe one you didn't even need. And that test finds something which leads to another test, and then another procedure. And suddenly, you're caught in this whirlwind of appointments and interventions. I mean, think about this story. There was this amazing 78-year-old woman, full of life, always in her garden, playing with her grandkids, just vibrant. But after one of these routine checkups, she got sucked into this cascade. And just 3 months later, she was exhausted, full of anxiety, basically a prisoner to her clinic appointments. Her focus totally shifted from living her life to just following a medical protocol.
So, with that in mind, let's walk through 5 of the most common tests that can turn into these health traps, especially for folks over 70. We're going to break down why the old rules just don't apply anymore, and how something that was once helpful can actually become harmful.
First up, trap number 1, the colonoscopy. The promise is simple: peace of mind, catch things early. But once you're past 75, the risks can really start to creep up. That whole prep process, it uses these super powerful laxatives, and they can leave you seriously dehydrated. They can throw off your body's essential salts, which is a huge risk factor for dangerous falls. And then you've got the anesthesia. For some older adults, it can trigger this lingering confusion and memory loss, a kind of brain fog that, for some, never really lifts.
And this isn't just theory. This story just shows you the real human cost. There was a 76-year-old retired teacher, totally full of life, no symptoms whatsoever, but his doctor pushed for a routine colonoscopy. The prep hit him hard, left him super dehydrated. In the middle of the night, trying to get to the bathroom, he fell, and he broke his hip. And that one fall, it changed everything. It cost him his independence. He never really got back to his old self. And it was all from a test for a problem that, honestly, probably would have never bothered him in his lifetime.
Okay, trap number 2. I like to call this one the machine of fear, the full body scan. The sales pitch is so tempting, right? See everything, catch anything. But the truth is, these scans are almost too good. They pick up every tiny little thing. An old scar on your kidney from decades ago, a harmless little bump. They call these incidental findings. And they're basically a one-way ticket to anxiety and a whole new cascade of risky follow-up tests and procedures.
This is exactly what happened to a perfectly healthy 73-year-old woman. Her scan flagged a suspicious spot on her kidney. So, of course, the protocol says you got to do a biopsy. But during that procedure, her lung collapsed. She ended up spending a week in the ICU. It took her months to get back on her feet, and she never quite got her old energy back. And that suspicious spot? Turns out it was just a harmless old scar she'd had forever. Think about that. She basically traded her robust health for a piece of information that meant absolutely nothing.
All right, on to trap number 3, the cardiac stress test, especially for someone who has 0 symptoms. Look, a heart that's been beating for over 70 years is just different from a 35-year-old's heart. It's not sick, it's just well-seasoned, right? Arteries get a little stiffer, the rhythm might be a bit different. But these stress tests, they're not really designed to recognize that normal age-related change, so they often flag these things as problems, and boom, you get a false positive.
This is what happened to a 74-year-old man. He was an active walker, no chest pain, no shortness of breath, nothing. But he got a just-in-case stress test, and it showed some kind of abnormality. That led to an invasive procedure and a so-called preventative stent for a minor blockage that's actually pretty common for his age. Well, he ended up getting a really serious infection from the procedure, lost a ton of weight, and just never got his energy back. And here's the kicker. Study after study now confirms that for older folks without symptoms, these procedures often don't help you live longer or even prevent heart attacks.
Now, let's talk about trap number 4, the bone density scan. This one is often just fear disguised as prevention.
And here's the crazy part. The standard they use to decide if you have weak bones is based on the bone density of a young woman. It doesn't really account for the natural, totally normal loss of bone mass that happens as we get older. So what happens? A perfectly healthy 70-year-old gets slapped with a disease label for something that's just a part of aging.
And the irony here is just so cruel. Picture this, a vibrant 70-year-old woman. She loves her garden, she loves swimming, she's never had a fracture in her life. She gets diagnosed with a bone condition. Suddenly, she's terrified to move. She stops doing all the things she loves. The medications they put her on have awful side effects, and within a year, she's become frail and fearful. Not because of the condition, but because of the diagnosis and the fear that came with it.
And finally, trap number 5. This one's a sensitive topic. Routine cancer screenings after the age of 75. You know, the hard truth is that a lot of the issues found in older adults are so slow-growing, they would likely never cause a single symptom or affect their lifespan. But once it's found, the medical machine kicks into gear. You're looking at aggressive treatments that a more fragile body just really struggles with. The treatment itself can end up doing more harm than the disease ever would have. It's a tough thing to think about, I know, but facing it lets us start asking a different and honestly a much more powerful set of questions about what health really means.
Okay, so after hearing about all these traps, it's pretty easy to feel a little down. But this is where the whole story pivots. This is not about giving up, far from it. It's about getting smarter. It's about recognizing that after 70, the goals of medicine really ought to change. It's about embracing the wisdom that comes with choice.
And this slide just lays it out perfectly. You've got two totally different ways of thinking. For so long, medicine has been all about fighting time, right? The goal was just more years, quantity at all costs, with a focus on lab results and procedures. But the new path is about living with time. The goal shifts to quality of life. The focus becomes your autonomy, your dignity, your joy. And the method, it changes from just aggressive intervention to wise, careful observation.
So, if we're going to set aside some of those routine, one-size-fits-all tests, what should we be focusing on? Well, it's time to talk about a new set of tests, ones that actually measure what matters for a happy, independent life. This right here, this is your real checkup. Number 1, functional stuff. Can you get up from a chair without using your hands? Seriously, try it. That one little test can tell you more about your future independence than any fancy scan. Number 2, your cognitive health. Is your mind still sharp? You remembering appointments? Number 3, social connection. You know, loneliness can be more dangerous than a lot of diseases. Do you have people? A community? And number 4, your well-being. How do you actually feel? Are you in pain? Are you sleeping okay? These are the things that actually define your quality of life.
You see where this is all going, right? It leads to a really powerful conclusion. After you've lived for 7, 8, maybe 9 decades, you've earned a kind of wisdom that you're just not going to find on any medical chart. It's time to take the pen back and write your own health story.
So here's a little framework you can take with you, a kind of personal health philosophy. First up, quality is greater than quantity. Let's focus on years of good living, not just more years. Second, symptoms over tests. How you feel day to day. That's probably the most important piece of data there is. Third, function over findings. Being able to do the things you love, that's the real measure of health. And finally, and this is the big one, choose wisdom over fear. Make your decisions from a place of calm, lived experience, not from all those scary what-ifs that keep you from enjoying the what is.
And let me just leave you with one last story, because it's so inspiring. There was this 80-year-old woman, and she saw her friends just suffering, going through endless tests and treatments, and she decided to make a different choice. She told her doctor, no more routine screenings. Instead, she focused on living well. Good food, good friends, lots of laughter, a little light exercise. And when her time came, she passed away peacefully, in her sleep. Not in a clinic surrounded by beeping monitors. She chose a life that was defined by conscious joy, not by clinical fear. So the big takeaway here is this. You have the right to ask questions. You absolutely have the right to say no. You have earned the wisdom to know what truly matters for you. So I'll just leave you with this to think about. At this stage of your life, what does living a full life really truly mean to you?